Hey, Dr. Adam here. We're going to continue my video series on chiropractic philosophy. In the first video, I talked a little bit about my testimony and really, just want to dive into a few things as far as why chiropractic, how that can be helpful and beneficial. And I also want the purpose of this video, if you listen to this and you hear something that you've been helped with chiropractic that I don't list off, talk to your doctor about it, bring it up, talk to me about it. I'd love to hear this because chiropractic can help with so many different things that, classically people think about headaches, neck pain, back pain. But they're really pleased when, they have more energy or better sleep or different health outcomes, because really your nervous system controls every other function of your body. So every other system and all the way down to the cellular level. Just think, if you touch a hot stove, how fast that pain signal goes to your brain to create a reflex and a response. But if your nervous system has taken damage through the form of either thoughts, traumas, or toxins, then that can disrupt proper nervous system regulation and function. And that's where dis-ease or lower function can enter in. So most commonly, we're going to talk about subluxation. Okay, so a subluxated nervous system does not work as well. All other systems will not work as well as with that. So with an unsubluxated nervous system, you heal better. You have faster reaction time. It's been studied that athletes have an 18% faster reaction time. You're sick for less time or sick for less often because of the higher immune function. There's less headaches, less frequent, less intense, less often having a migraine, fewer times visiting the emergency room. I mean, that's been studied that people who are under chiropractic care show less medical expenses overall, less trips to the ER. That investment in your health goes a long way. Better digestion, improved thyroid function. We have a client who has considered spontaneous remission for her Hashimoto's disease. The only thing she changed was getting adjusted on a regular basis. Taking care of the reverse curve that controlled the nerves to the thyroid. Improved pain, increased range of motion, better sleep. Of course, the improved pain and the increased range of motion. I had somebody who came in the other day and she could not turn her head without pain. One adjustment and boom, she could turn. Now, that doesn't mean that it's holding in place, and we need a corrective plan to mold the muscles, ligaments, connective tissue. With chiropractic, it's not always about how often you're adjusted, but how long your adjustments hold for. People report better sleep, able to take a more full, deep breath, more energy. And again, this is just a list that I rattled off. I'm sure that there are more on this list. I know there are things that I'm missing because, we've just seen tons of anecdotal evidence, tons of testimonies of people here in the office. And then another thing that's just kind of coming to my brain right now is I took care of a client who had chronic kidney disease and started to reverse better numbers, increase bone density. I had somebody who was in her 70s who gained an inch of height. She went from 4'10" back up to 4'11". Some of you watching this video, I know, have more testimonies, more power. Just continue to speak that into friends, family members, loved ones, coworkers. Tell your doctor. I'd love to have a conversation with you in the office about something that I missed on this list. But chiropractic is awesome, and just this keeps me energized and excited about our profession. So hope you're out there staying happy, healthy,